Hi, I'm Dr. Jane. Many of you will know me as your GP. Welcome to Healthcare Homes. I'd like to spend this next few minutes just outlining to you a new program that the practice is involved in. Healthcare Homes is a pilot project that is funded by the federal government. It involves currently 179 practices. And the purpose of this program is to look at some alternative funding models aside from Medicare in primary care, and to achieve the quadruple aim. The quadruple aim involves you and your experience as the patient and trying to improve that so that we're meeting your health needs. And in doing so, improving the population of our community, both statewide and nationally, by reducing costs. We do waste a lot of money on processes in healthcare, and we want to improve the work life of healthcare providers because there are not many of us, especially in the regional area where we live, and that puts increasing demand on the services that are available. We currently run the Keep Well Clinic, and many of you who have been invited to look at this video and to consider signing up to Healthcare Homes has been part of the Keep Well Clinic, and that would be to have your health assessments and your GP management plans done with us on a regular basis, all with the purpose of trying to improve the health conditions that you are currently experiencing. This care would not change, and as you can see from the diagram on the PowerPoint, that we would continue to offer the same amount of care. How we fund that, though, would come from two different areas depending on your eligibility. Medicare is the current model that we use, and it has tried to provide comprehensive chronic disease through an item number focused program, but it's quite inflexible and at times quite frustrating for both you and for us as the providers of your healthcare. Healthcare Homes is different in that we get access to a bundled payment over a 12-month period that we budget with you and with ourselves to provide you comprehensive care. It's more flexible, and the amount we may have to provide that care depends on which tier you would be classified as. To be eligible, we have used a practice tool to identify patients in our practice with chronic disease. We then use another questionnaire using the HARP tool to assess which tier you might be. And both of those processes are conducted with a nurse and a doctor. Once your eligibility is determined, you are then allocated to the doctor to conduct this care. Of course, for those of you who have been invited through Dom Medical Clinic, you will be seeing me as we're starting with my patients to see if this is a worthwhile program to roll out and involve everybody in the team. The care is patient-centred and collaborative. That's one of the main goals of this program, and to keep it appropriate and suited to the individual. We will also use a Promise 10 questionnaire to help us identify whether we are actually making any change for you, and we'll do that every 6 months. That's a measure of how you perceive your physical mental health to be at the time of the survey. If you're interested, then reply to this email and you'll be contacted by one of our staff. Or if you are in the practice, you may have been invited to look at this video so as to then follow up the discussion with Dr. Jane when you see her in the next little while. If you're interested, you must sign a consent form to be eligible, complete a health questionnaire, have a HARP tool assessment to identify which tier you might meet, register with Healthcare Homes, we use your My Health record, and the criteria of Healthcare Homes is that we upload a summary onto your health record. We do an online health summary that you can access along with any of your service providers, for example, optometry or podiatry, or even the school psychologist for our younger patients. We review this summary every 3 to 6 months, and part of the Healthcare Homes program is to have an annual health assessment. And I think this is one of the most exciting parts of this program because currently there are no dedicated item numbers that give us the time to provide you with an adequate health assessment, except if you are between 45 and 49 years of age and over 75. We'll also be required to do the 6 monthly Promise 10 as I've outlined before. Evaluation of the national program, though, will mean that if you consent, you will be contacted by the National Healthcare Homes team to provide feedback on your experience with the program at Don Medical Clinic. And this process is really important in evaluating this program as to whether it is effective. Certainly, we as a service provider will also be asked to evaluate the program and provide our feedback. What will change in your current care? Nothing. Don Medical Clinic already works hard to offer quality, accessible, affordable, confidential and non-judgmental healthcare that is consistent and collaborative both within and outside the practice. I'd like it to be more timely, but I am limited in the time that I have, and we are limited in manpower, as you all know. We are hoping that this program will allow us to be paid for the many jobs that we currently do that we are not able to be remunerated for. And examples are emails, texting, telephone calls, prescriptions and referral letters. Of course, the flexibility of the program means we are able to provide more ways of delivering care to you. And if you can't come in and see us, it might be that a Skype appointment is something that we consider doing. So the opportunities are actually endless if we want to be innovative and creative. For more information, please contact the clinic or have a talk to me when you come in to see me, or to the nursing staff or the reception staff. We are quite excited to be on this program. It is part of a national change to the delivery of primary care. And I believe unless we get involved, we will have no voice. So join us in bringing about change to our healthcare system. Thank you.